This pacifier is making your kid less healthy and uglier.
Before we even get into the meat of this video, a medical professional telling you that your baby's going to be ugly?
It's way too narrow for this dental arch. You suck on this, the pressure's gonna collapse the arch around it. This is the collapse from sucking on the pacifier too much. Child comes in, their bite looks like this. It fits much more widely within the palate, has a nice concavity where the tongue can still elevate a little bit, and it's narrow where it enters through the occlusion. These things are deforming your face, collapsing your upper jaw, your cheekbones, flaring your teeth, and narrowing your nasal passageway. This pacifier makes you uglier and less healthy.
He brings up a lot of good points, but here's what's up. People in the breast world and people in the tooth world, we often have very different points of view because we have different priorities in our practices. The things that I am going to talk about, they're going to focus on that latch and lactation and developing the muscles that are needed for effective breastfeeding. Whereas a dentist or an orthodontist, they're going to be focused more on your child's jaw development and their teeth alignment. There is no mention of the age category that he is speaking about, and you can see in those molds that that's a lot of teeth in that child's mouth. That is definitely not a baby between the ages of 0 and 6 months. In the breastfeeding world, we're often dealing with younger babies when breastfeeding is being established. In this age bracket, there is one risk of pacifier use, and that is stopping breastfeeding early, which we can mitigate by providing the proper shaped pacifier, and that is one with a round tip, a gradual slope, and a wide base. And I mentioned to you guys before that orthodontic pacifiers might be great for a baby over 6 months. This one could be good for a baby that's a little bit older, maybe 6 months plus. And this is the reason. This risk of teeth malformation from pacifier use, it becomes a risk around 2 years of age. And because of this, the American Academy of Pediatric Dentistry, they recommend having a dental home for your child by 12 months of age. And in this way, you have lots of time to make plans to stop any non-nutritive sucking by 36 months. I know that videos like these, especially when you're a new parent and you are anxious about a bazillion other things already, can be really, really scary. And that is why timelines and ages of the people you're talking about are really, really important, because the priorities for different age categories are going to be different. And your baby is not going to be ugly.